Although the COVID-19 pandemic is almost over, healthcare professionals are now preparing for a new pandemic called Disease X. Dame Kate Bingham, chair of the UK's vaccine Taskforce, said the next pandemic could cost up to 50 million lives. COVID-19 was not that deadly. The new pandemic is called Disease X by the World Health Organization, which Bingham says is 20 times deadlier than the coronavirus. According to Bingham, although scientists have identified 25 virus families that comprise thousands of unique viruses, there are millions of other viruses yet to be discovered, the Daily Mail reported. While COVID-19 and its variants have had an impact in terms of recurring and familiar health problems, healthcare professionals are now preparing for a new pandemic called Disease X. Healthcare experts have warned that this new virus could be as devastating as the Spanish flu. What is Disease X? The World Health Organization, who named the new pathogen Disease X, there is no confirmation that the new disease is a virus, bacteria, or fungus. It is also a concern that there is currently no cure for the disease. Disease X is thought to be as virulent as the Spanish flu of 1918-20. 50 million people died worldwide that day. Similarly, the new disease will be terrible. To combat this, the world must prepare for mass vaccination and deliver doses in record time. So far, scientists have identified a total of 25 virus families, but there are more than 1 million variants that have not been identified. There will also be those capable of spreading disease from one species to another. They also opined that the increase in epidemics is the price paid by humans for modern life and world order. As countries become more connected as part of globalization, diseases can quickly become ubiquitous. As more people move to cities and people-to-people contact accelerates the spread of disease. Deforestation, modern agricultural practices, degradation of plantations, etc., can cause the spread of viruses. Disease X is the term used by the World Health Organization, who present a hypothetical and unknown infectious disease that could cause a serious global pandemic in the future. The name is given to understand the unpredictability of emerging epidemics and the importance of preparedness for such events. The concept of Disease X was introduced in the 2018 annual report of the WHO Global Preparedness Monitoring Board, who points out that new and previously unrecognized pathogens can emerge at any time and pose a significant threat to humans. This pandemic will have an unprecedented impact on medicine. Therefore, finding drugs, vaccines, etc., will take time. The possibility of transmission of this disease from one person to another is very high. Those affected by this disease will quickly develop health problems and die. None of the current drugs and methods of protection work. Many emerging infectious diseases have zoonotic origins, meaning they are transmitted from animals to humans. Disease X is likely to emerge from wildlife reservoirs, similar to past epidemics such as HIV, Ebola, and SARS. The growing problem of antimicrobial resistance adds complexity to the threat of Disease X. Available antibiotics may not be able to prevent new infections. In an interconnected world with rapid international travel, the spread of Disease X can be much faster, making control efforts more difficult. As seen in the early stages of the COVID-19 pandemic, inadequate healthcare infrastructure and limited access to healthcare in some regions can exacerbate the impact of Disease X. Because the disease is highly transmissible, it can quickly affect a large part of the population. Vulnerable groups such as the elderly or those with underlying health conditions may be at greater risk. Lack of good hospitals and treatment capacity will increase the death toll. So what is coming will be the greatest pandemic humanity has ever seen.